My name is Amy Espen. I'm a licensed marriage and family therapist, and I'm certified as an addictions professional in the state of Florida, and also got certified in addictions in New York and California. Master's in marriage and family therapy, master's in cross-cultural education and diversity. I certified in something called addictions. It was a certification as an addictions professional.
Ms. Afferman is a solution-focused, systematic therapist, and she specializes in substance dependence and mental health issues. And she has worked in different areas within the counseling field to include addictions counseling, depression, anxiety, schizophrenia, bipolar disorder, self-esteem issues, trauma, relationship counseling, and family issues. And she has also trained medical professionals, graduate students, and colleagues in various areas of addiction studies at a university level and for CAP and PhD certification. I did this interview with Ms. Afferman by phone. We had a voice call at about 6:30 in the evening at home. Therapists are usually very busy, so discussing meeting time is extremely important. My purpose of doing this interview is to find out how is it like being a therapist, what is the daily routine, how and when do they find out that they have interest in psychology, and for my therapist specifically her treatment style and her clientele. So I divided my thesis and the presentation into 3 parts. The first one is why they choose and enjoy their job. The second one is specific category or different therapy that they study and their treatment style. And the third one is overall experience of the job and what did they gain from the experience and job.
Good question. Life experiences. So through my own relationships and friendships, I found that I wanted to help others in my daily work. After reading a book called A Child Called It, and then I became a guardian ad litem. I don't know if you've heard of this. It's like a volunteer role with the court, and that was to advocate for abused children, abused and neglected children through the court system. Solution-focused and narrative therapy. Okay, so I'm going to give you examples. One would be identifying ways in which someone has done something that they're struggling with at this time, identifying ways they've done it well or good in the past. It's pretty neat. I'm going to give you another example called, it's complex though, it's called externalizing the problem. It's a narrative therapy intervention, and it's called externalizing the problem. So I'm going to give you an example. If I'm working with Tom, and Tom has a problem with alcohol, let's say, we're going to talk about the relationship with alcohol as though it's another person. So I'm going to say to Tom, how has your relationship with Allison interfered with your marriage with Melissa? And so everything that we talk about Allison, we're going to talk about it being a relationship and how that relationship with the substance has affected his relationship and his marriage. Instead of saying, you're an alcoholic, you did it, it's your fault. Instead of blaming person, we blame the relationship with the substance. So in a way, instead of making someone more depressed about everything bad that they might have done because of their drinking, we blame the relationship with the substance. If you could identify how you would rate depression right now from 0 to 10, 0 means you have no depression, 10 means you have the worst depression you've ever had, what would you rate it right now? So if they say a 5, then I would say, well, if I wanted depression to become a 3 by the end of the week, what would have to happen? So we call it scaling questions. I would have to say, honestly, through trial and error. So I prefer non-confrontational, collaborative therapy. So non-confrontational means you're not up in their face, it's very direct and aggressive. Instead, it's collaborative, meaning I'm not the expert. I ask them to join me in coming up with solutions that work for them.
So therapists usually work with medical people as well?
Great question. I work with, I almost always work with a psychiatrist or a psychiatric nurse practitioner when I'm working with people with addiction and mental health problems, which is the majority of the people I work with. Unfortunately, with me, some therapists have very, very good boundaries. I'm available 24/7 by phone. So in emergencies with therapists, I don't know if you're familiar with the Baker Act in Florida. If a client presents with plan or intent to harm themselves, they have plan or intent to kill themselves, or they have plan or intent to kill anybody else, we call it the Baker Act. And so typically an emergency for me is like clients have called me, even old clients call me, and they say they think they want to kill themselves. If they tell you, even whether it's on the phone or in person, that they want to kill themselves or they want to kill someone else, you have to ask if you're licensed. So you have to ask them these questions. Do you have plan or intent? If they say yes, I'm going to jump off my balcony, or yes, I have a gun, I'm going to shoot myself, or yes, I'm going to take these pills, and that means they have plan and intent, then a licensed therapist like myself legally has to react. We're state-mandated reporters, which means if they're not sitting there or if they're sitting there, we contact 911 and we tell them that we have a client that needs to be Baker Acted, and then the police will come to either the office, or I've had people call me from a hotel saying they're going to jump out the window. The police will go to that patient's hotel room and they will ask them questions, and if they determine that they're Baker Act material, they will handcuff them and take them to a Baker Act receiving facility. It's $150 per session, and then if the court evaluation, $300. Just seeing people change their life for the better. Specifically, if someone's very depressed or unhappy with their life, and then 2 years later they tell me either they've been sober for 2 years, or they're happily married, or they have a child, that feels really good.
Is that an inappropriate question?
No, it's a totally appropriate question.
Okay.
Because this is a topic that like most therapists are very bad at. So they help everybody. The reason why they help everybody else and never do anything for themselves. So for self-care, what do I do? That's a good question. I try and spend time with family and loved ones. You know, specifically significant other and close friends and family. That to me is like my self-care. But I also like to go to the beach and dance and go to the gym. The answer would be professional relationship, meaning that in therapy we have to have very, very good boundaries. So when I started, I was in my mid-20s, and so if a young guy comes in and tries to hit on me, or say after session, they say, oh, so what do you do on the weekends? Or I'd like to take you out to dinner. You have to totally put down the gabash. You know, I'm a therapist, you're a client, that's inappropriate, we're not talking about that. So maintaining very good boundaries. Okay, so I guess a lot of good advice. Two things. One is definitely complete a master's degree.
Master's degree.
So in the state of Florida, there's 3 options to become licensed. So everybody thinks if I go for a master's in psychology, then I will be the best off. That's not true. There is no master's in psychology that can be licensed. The 3 licensed master's degrees would be marriage and family therapy, mental health counseling, or social work. So that would be that advice. And then the other, it seems obvious, but the really good advice would be to choose an internship in an area that you want to work in, because typically the internship, you learn the most on your internship.
By doing this interview, I now have a better understanding of what the process is during treatment session and how therapists work differently in terms of therapy depends on patients' different needs. And because I'm personally really interested in psychology and considering going to psychology major in college, my therapist, Ms. Effman, shared with me very useful information regarding her own experience of being a therapist. And because of that, I've never known anyone in real life that is a social worker. It is really a very cool experience that I actually had a chance to talk to someone that is a therapist. During the interview, I realized some of the information we've talked about this year in class, and it is very cool to know in real life. And I definitely learned more about the therapist as a job.